Hi, everyone. So this is an information webinar for 2018-2019 Patient-Oriented Leadership Grant Competition 2. My name is Alessia Hersky. I'm a Funding Programs Officer with SHRF, and I'm here joined by Kate Dunn, who's the SCPOR Program Facilitator. I just want to note that this webinar will be recorded and can be found on SHRF's YouTube page at a later date. So the agenda for today's webinar, we'll talk about the funders, SHRF and SCPOR, as well as about the program and what's new. We'll go over important dates and grant funding, and then dive into eligibility and application process, review process and criteria, and finish off with some tips for good application and Q&A session. So SHRF, we are the provincial funding agency working to achieve a vibrant culture of health research and innovation for a stronger Saskatchewan. We do this by encouraging success, connections, and action within and beyond the research community. We invest in high-impact, peer-reviewed health research aligned with provincial needs to build and broaden Saskatchewan's capacity for health research and innovation. And Kate will tell us what is SCPOR and what they're all about.
Thank you, Alessia. Hi, everyone. This is Kate Dunn here, Program Facilitator with the Saskatchewan Centre for Patient-Oriented Research, otherwise known as SCPOR. And our mandate is to support patient-oriented research in the province of Saskatchewan. We want to support an environment where patient, families, clinicians, researchers, and policymakers work together to identify research topics, do research, and then use the results of that research to improve patient care and the health system. During our leadership grant, there are two phases of support we can offer researchers. First are the supports happening during the application phase, and the second phase of support can be accessed by grant recipients. Our supports are offered through the 5 SCPOR platforms: patient engagement, Indigenous research and engagement expertise, data and data services, knowledge translation, training and capacity building, and our methods platform. Some of the supports offered in the application phase include, but are not limited to, patient and family advisor recruitment, patient-oriented research module training, data services consultation, knowledge translation references, consultation and quotes from research SCPOR partners such as the Clinical Trial Support Unit, Social Science Research Lab, and the Clinical Research Support Unit. Some of the supports offered to the leadership awardees include, but are not limited to, patient and family engagement coaching and facilitation, patient engagement evaluation, OCAP compliance and empowerment coaching, data extraction and linkage, GIS mapping, assistance with knowledge translation development plans, and methods consultation. For more information, please see the application package, specifically Appendix A and B. Back to you, Alessia.
Thank you, Kate. So the focus of Patient-Oriented Research Leadership Grant Competition 2 is to promote dynamic applications of patient-oriented health research innovations. Grant recipients will contribute to achieving cultural change in how patient-oriented research is done, provide evidence-informed improvements for the healthcare system, and strive to improve patient outcomes. Core Leadership Grant will provide funds to carry out research and to support a portion of recipients' salaries to protect time for research activities. The objectives of this program are to enable patient-oriented research leaders at any career stage to carry out a program of research while residing and working in Saskatchewan, to facilitate meaningful creation, exchange, and uptake of patient-oriented research innovations to benefit the people of Saskatchewan through partnerships between researchers, decision makers, patients, families, communities, and clinicians. And lastly, to develop a collaborative cluster of patient-oriented researchers who will contribute to realizing SCPOR's mandate and vision. To help better understand the purpose of the program, we would like to give you brief definitions to the terms used in the tagline of promoting dynamic applications of patient-oriented research innovations. So what is patient-oriented research? Is research that engages patients as partners throughout the process while addressing patient-identified priorities to improve patient outcomes. It's conducted by multidisciplinary teams, including researchers, patients, healthcare providers, and health system decision makers, to creating new knowledge that can be applied to improve healthcare system and practices. Dynamic. The aim of this grant is to use patient-oriented research to aspire change or progress in the healthcare system. And lastly, innovation. The grant must focus on one of the following: the development of novel research questions, the use or development of novel approaches or methodologies, including knowledge mobilization methodologies, or the application of existing methods or concepts to a novel research questions in new ways or in a new setting. Prior to opening an application, the principal applicant needs to complete an eligibility check on their SHRF's RMS. Eligibility is a rolling intake where you can submit at any time between now and eligibility check cutoff date. After this date, we will no longer be accepting eligibility, and principal applicant will not be able to access the application. There is one budget to submit, and it must follow both the SHRF's guidelines and the Tri-Agency Financial Administration Guide use of grant funds. Please see awards guide and leadership application package for more specific details. There's also a mandatory SCPOR module training, which is a two-part course intended to help participants acquire foundational knowledge about the health research. It's offered through SCPOR, and the dates when the training will be offered can be found at scipor.ca. And lastly, there's a rooted committee. The successful leadership recipient will be required to meet with SHRF and SCPOR Joint Committee, and I will provide more details further in the presentation of what the rooted committee is. So these are the important dates. Obviously, the application was launched on September 17th. Today, we're doing the information webinar. The next important date is October 25th, which is the eligibility check cutoff. The eligibility is a rolling intake, but must be completed by the cutoff date. At this time, if you are denied eligibility, there will be no more chances for revisions and resubmissions. So we strongly suggest that you start working on and getting your eligibility in as soon as possible. The application deadline is December 5th, and so is the time by which mandatory training must be completed. Once your eligibility has been submitted and approved, you'll be able to start working on the application for this deadline date. Please note that applications will be screened after the deadline to make sure that eligibility is still met, especially when it comes to if the training has been done by the cutoff date or not. The review will happen early in mid-February with decisions out by February 28th and a start date of March 1st, 2019. And now let's talk more about actual grant funding. So the total value of the funding is $250,000 over the 3-year term, and this funding is not renewable. SHRF's contribution is up to $40,000 a year for the 3 years, and funding provided by SHRF is to support a program of research in Saskatchewan. Principal applicants can request an amount up to $40,000 a year for time release, teaching buyout in the application to allow for sufficient time to engage with partners and complete the program of research. SCPOR contribution is up to $65,000 a year for the first 2 years. Funding provided by SCPOR is to further support the program of research in Saskatchewan in the first 2 years, with applicants encouraged to seek other funds to sustain the program of research for the year 3 and beyond. SCPOR funding cannot be used for any form of time release. Additional in-kind services and supports for grant recipients will be provided by SCPOR through the following platforms: patient engagement, Indigenous research and engagement expertise, data and data services, knowledge translations, training and capacity building, and methods platforms. A minimum of 4 applications will be funded. So before you start, there's a couple of go-to guides that we suggest you go to. The most recent leadership application package, which has 3 components: the program guide, the application instructions, and the high-level checklist. The program guide provides the information specific to the funding opportunity, including eligibility requirements, definitions, partner information, allowable expenses, and other core information. This should be read alongside the most recent awards guide. The application instructions will give you information for both the eligibility and application forms found on the RMS, so that you can get a sense of what is being asked for this opportunity prior to opening an application on the RMS. As application on RMS is very general, you must refer to and follow specific application instructions outlined in the leadership application package. Finally, for those of you who enjoy checking things off, we've created a high-level checklist, which helps you think of the steps that need to happen to submit the best application. Then we have the most recent awards guide, which gives you general information that all SHRF applications must follow. The last one has been updated on June 15th, 2018, and to reflect changes for the signature page and a new conflict of interest policy, as well as MOU with Parkland College. SHRF's RMS, after logging in, you can find a program guide and RMS manuals to help you with your application, along with eligibility check and application. SHRF.ca, there's a couple of pages there. There's funding resources, opportunities. You can find links to YouTube channels and how-to videos, as well as SCPOR.ca for information on funding partner, in-kind services offered, dates for mandatory training, etc. So eligibility check. This year we have introduced the eligibility check, the purpose of which is to check that the application is submitted to the appropriate funding opportunity, where the applicants have identified how their work is relevant to the purpose and objectives of the funding program. We will check that eligibility is met for the principal applicant based on the listed criteria found in application package. This will facilitate the creation of the review committee. Once we begin to receive the eligibility information, we can begin our search for finding the appropriate reviewers and creating relevant committees to application demand. We will inform partners, in this case SCPOR, of interest, as well as to help us formalize the process of eligibility, where if decisions are made by the program manager and SHRF, in this case, it's now in writing on the application for both the applicants or reviewers to see. So eligibility check is internally reviewed by the program manager, where we follow the above principles and check only for eligibility. This is not a preliminary review process. If questions do arise, the program manager will be in contact with the principal applicant. From this, there may be a request that revisions are required for eligibility. Once the requirements are met, the program manager will push your eligibility to the application form so you can now access all the fields. As I mentioned before, this is a rolling intake, so you can access and submit your eligibility check anytime for the next several weeks up to the cutoff deadline. After the deadline, no more eligibility checks will be accepted and applicants will be notified of the results by November 1st, at which time, if the eligibility is not met, you will not be able to make any revisions. So we do ask you, please submit early. This is a sole applicant grant. The eligibility requirements for the principal applicant can be found in the definition section of the application package, but must meet the following requirements. Principal applicant must be self-directed and autonomous, must be able to hold peer-reviewed funds and publish research results, must be affiliated with Saskatchewan institution that holds Memorandum of Understanding with SHRF, can supervise staff and trainees, must reside and work in Saskatchewan during the full duration of the grant, and must have at least 50% protected time for patient-oriented research activities pertaining to this grant, including buyout time from administrative, clinical, and teaching responsibility at minimum of 20 hours a week. We will request a letter of support required to confirm amount of protected time, and it can come from department head, dean, or equivalent. And lastly, previous awardees of Leader Award 2018-2019, which would be the competition 1, are not eligible to be principal applicants in Leadership Grant Competition 2. The application process. So this funding opportunity involves 2 steps: the eligibility check, which we've described a little bit, and the application. Both steps must be completed and submitted online using the SHRF's RMS at shrf.smartsimple.ca. It's the principal applicant's responsibility to ensure that all requested information is complete and properly formatted at all stages. Applications received in any other format or exceeding page limits or submitted incomplete may be declared ineligible. If eligibility is no longer met at application submission or review period, SHRF reserves the right to remove the application. Materials irrelevant to that request in an application will be removed from the application and before it's sent to the peer review. Applications submitted late will not be accepted, and SHRF assumes no responsibility to notify applicants or follow up with respect to incomplete or non-compliant applications. Please see Patient-Oriented Research Leadership Grant application package for more specific application instructions. Review process. So this is a slightly different review process than what we had, I guess, for the last competition. Each leadership grant application will be reviewed by two separate committees. A patient-led committee, which will consist of patients from Saskatchewan, will evaluate applications on the degree to which a given project meets the patient-oriented research criteria by using patient-oriented research evaluation tool as a guide, and the tool can be found at SCPOR.ca. Application will also be reviewed in a competitive peer review process according to SHRF's research funding peer review committee guidelines. The committee will consist of multidisciplinary research and knowledge users outside of Saskatchewan, but within Canada, who are experts in patient-oriented research. Applicants will receive written comments from two lead reviewers on each committee assigned to the application, as well as possible additional comments from the patient-oriented review committee. Any concerns or conditions outlined by the patient-oriented review committee must be addressed during the first rooted committee meeting, and further instructions will come from SHRF after this funding decision. I will talk again about the review committee a little bit further. To be considered for funding, applicants must meet a minimum score from the patient committee and rate at least 3.5 or higher on SHRF's 5-point scientific merit and impact scale. A final overall score achieved by an application will factor in both the scores achieved in a patient-led review meeting, weighted at 30%, and the peer review meeting, which is weighted 70%. Funding will be allocated by the overall final score from highest to lowest until SCPOR and SHRF funds for these competitions are exhausted. So the review criteria for patient-oriented committee. The patient reviewers will evaluate the degree to which a given project meets patient-oriented research criteria as defined by Strategy for Patient-Oriented Research, SCPOR, using the patient-oriented research evaluation tool as a guide. 4 equally weighted criteria will be used for evaluation: patients as partners, patient-identified priority, patient-reported outcomes, and integration of knowledge into practice. As I mentioned, patient-oriented research evaluation tool can be found on SCPOR website at SCPOR.ca. The multidisciplinary reviewers will consider both the scientific merit and the potential impact of the research proposal using the following criteria: track record relative to career stage at 40%, program of research at 40%, and lastly, environment, partnership, and support at 20%. More details about the review criteria can be found in the application package. So Rooted Committee, this is brand new to this competition. It's a dedicated committee that's created for each successful leadership program of research comprised of representatives from SHRF and SCPOR. Successful recipients will be required to meet biannually with Rooted Committee during the first year of the grant, and then annually during the last 2 years of funding. As I mentioned previously, any concerns or conditions outlined by the patient-oriented review committee must be addressed during the first Rooted Committee meeting. The purpose of this meeting with Rooted Committee is to discuss the successes and challenges of the research program. Meetings will be a venue for communication between the leadership grant recipients and the funding organizations. We hope that these Rooted Committee meetings be a mutual benefit to the researcher and SHRF and SCPOR. And I just want to note that Rooted Committee meetings do not replace the written progress reports. So these are some of the tips that make best applications. Put yourself in a reviewer's seat. We want you to grab their attention by making your case, by answering so what questions, as well as writing your proposal clearly with sufficient amount of details. Address potential bumps in the road. We all know research isn't perfect and things always don't always go how planned. Make it easy for reviewers to follow to understand, follow the instructions, use headings, and check your math, especially for the budget. We don't want to be distracting our reviewers with numbers that don't add up. And so I think with that, we will finish the information session, and now we can move on to question and answer session. Any questions? Hi, so we have a couple of questions. One was, what is the success rate from the last competition? And so we had 13 applications last competition, out of which 6 were funded. Then we also have a question if there will be a copy of the slides available, and it will be. The presentation will be posted on YouTube. Information when it's posted and where it is will come in an email. If you have registered, it will just be sent to you when it's ready to be uploaded. We also had a question if we're able to share the number of eligibility applications that have already been submitted. And that's information that we don't usually share with the applicants. So at this point, I won't be able to answer that question. We have a question about the budget. The maximum budget is $250,000 per grant, and it is correct. We also have a question that last time there were priority areas, and this time around there are no priority areas. As long as you fit within the purpose of the program, you should be fine. So a couple of more questions. One is, can the applicant hold the SHRF leadership along with other release time programs such as Canada Research Chair? And technically speaking, you can. You do need to have 50% of protected time dedicated to leadership grant. You figure out whether it fits within your schedule or not. It's hard for me to gauge right now, not knowing how much protected time you have for the Canada Research Chair. Another question is, so can the budget be less than 250,000? And yes, it can. The maximum is 250, but if you have a smaller budget, that's totally fine. How many applications will be funded this year? And is there a set limit? There is a minimum of 4 applications that will be funded. We did not set the high limit. Any more questions? Okay, we're here for another minute or two for the last minute questions, so do feel free to ask. And if you have some questions later on and you want to reach out, this is our contact information. There's my email and my phone number, as well as Kate's email and phone number, and Tanya, who's our RMS guru. So if you have any questions or concerns about RMS, contact Tanya. I think most of you actually might even know her already. We have a question about what career stage is this targeted for, and anyone from any career stage can apply. There are some specific requirements for the early career stage researchers. We require some letters of support, and that can be found in the application package. But if you do have any more questions about that, feel free to reach out. Okay, I think we are good for questions. Again, like I said, if you think of something further down during the day or tomorrow or next week and you have questions or concerns, please do feel free to reach out. Thank you, Kate, for coming in today. And with that, I will finish this information webinar. And as mentioned, this will be posted. When it's posted, will come out in the email. Hope everybody has a good day and all the best.